It's me. I don't know if you're tired of me yet. I've gotten a few comments of people that don't like me, call me a show-off, but that's okay. I still love you back. But I really do like the people that do say that they like what we're doing. This is not about patting myself on the back. It's really about showing you what we're dealing with on a day-to-day basis. I think what makes 3D Dentist so fantastic is that we're a group of everyday practicing dentists just like myself. And I believe we need to support homegrown, dentist-run, dentist-owned businesses and not corporate-owned businesses, so that way we can keep our profession great. Okay, but anyway, soapbox over. This week we're going to show you a case where we had a patient walk in the door. We didn't expect this to happen. Tooth number 10 had an existing endo with the post and core. It came in and of course it was broken down to the gum line, and we needed to go ahead and take care of him. So in this particular episode we're going to be focusing on getting out tooth number 10, doing some grafting, but we also had a little bit of a buccal dehiscence. So I'm going to walk you through what kind of membrane we're going to use. We're going to use a PTFE membrane. We're going to tuck that in on the buccal without raising a full flap. We're going to tuck that in onto the lingual, and then we're going to do some suturing over our graft material. So I hope you like this week's episode. And again, 3D Dentist, 3d-dentist.com. Love to see you here. All right, here's an x-ray of our patient, tooth number 10. This is before he came in with the tooth coming off. And the first thing I always do anytime we're considering this is I want to see if an immediate placement is possible. In this particular case, immediate's not possible. The tooth came off. You can see where it's fractured. And now we're ready to go ahead and remove the root. We're going to use elevators, and with just basically elevators alone, we're able to get this out. Please notice how I'm always using a finger on the buccal plate to just kind of see that. Now we're going to go ahead and curette. And what I noticed right away is that the buccal plate was absent. So in this particular case, we need to go ahead and place a membrane. And I wanted to avoid laying a big flap in this case. So we're going to go ahead and kind of just kind of envelope tunnel this area. So we're using our periosteal and a blade and just kind of getting that in there. And here I'm using rongeurs to clean out any tissue tags and excess tissue. And now we're going to go ahead and trim our PTFE membrane to size, and there we tuck it up underneath. I've made it look like essentially like an ice cream cone, and then that way I can move it into the buccal there and then tuck it in to the palatal after I get my graft material. And again, as always, we use PRF mixed with bone, corticocancellous bone, and then we're going to go ahead and fill in our socket. We're going to tuck that into the palate, and now we just need to do sutures. Here I'm going to use PTFE sutures. We're going to do a horizontal mattress suture, tighten that up nicely, and then probably do a couple of extra sutures here just to make sure everything's done. On these particular cases, I'll see my patient at the 2-week mark to remove the sutures, and then the 4-week mark to remove the PTFE membrane. Nice and clean. Remember, dilute your surgical site to clean it out afterwards. And here is our picture, x-ray after the fact of the extraction socket. Hope you enjoyed this week's case. Man, don't you love it when emergencies come in, they just throw your schedule off? But again, so much of this is about knowing what you're doing, having the products in place, having the techniques in place, getting your assistants on board, making sure they understand why, when, where you're going to use it, so they're thinking one step ahead of you. And that's what we're great at 3D Dentists. It's about showing people, lifting up team members so they can best support you, so that you can expand your services and move beyond basic dentistry. Hope you like these videos, and let us know what you want to see so we can make some other videos other than the same things I do day in and day out. Thank you, and have a great week.